Hey everyone, how's it going today? My name is Zach Courier, and I have the pleasure of being joined here by Dr. Mikhail Bishai. How are you doing today, doctor?
Good, how are you?
Good, good. Thanks so much for joining us from Conroe, Texas at Woodland Psychiatry. Can you give us a little bit of your background of how you came to start Woodland Psychiatry, how you got into mental health?
Sure. Hello, everyone. Hoping you guys are safe. My name is Mike Bishai. I started out my career as an orthopedic surgeon in Africa and Egypt. I've been in the United States since 1999. Started up when I came to the United States. I found the mental illness is a few decades advanced than back in Africa. So I decided to join in New York, in Brooklyn, New York, as a psychiatry residency. And then I moved on to do psychosomatic medicine and sleep medicine in Hershey Medical in Pennsylvania. And around the same time, I started missing the procedure part that I did in orthopedic surgery. So I joined interventional pain management in Pittsburgh as a fellowship training, and I also was board certified in pain management. I work in the mental health as a whole. So I do treat like depression and anxiety, bipolar, schizophrenia, schizoaffective disorder. I added to my practice Ketmaine Infusion and TMS, and also I've been doing the psychotherapy myself with my patients. It's, let it be family counseling, group psychotherapy, psychodynamic treatment, behavioral psychotherapy, CBT, DBT. So it's kind of like we're around it. I do also provide on-site ketamine infusion suite that is monitored by an anesthesiologist who is my partner in the pain practice. But he of course does not see any psychiatric patients. Finally, close to about a year ago, I started incorporating into my practice TMS. With amazingly successful results. The TMS has become very accepted, and people basically, a lot of people are aware of it, and they do ask for it specifically. And I do have the deep brain stimulation device, BrainsWay, as there is no particular data to show superiority over the other devices, but it is the newest and more advanced device in the market. So I decided to acquire this device and I do have some amazing results, especially like with my pain management practice. And also I was board certified in psychosomatic medicine. I did not renew it. Supposed to be renewed 2018. I have not renewed this board certification in psychosomatic medicine. But with my experience in psychiatry, pain management, and psychosomatic medicine in between, this is like provide to the patient like wide varieties of care, including also like detoxification of opiates and of benzos, of alcohol. I did have an inpatient unit in the second floor of this building here, a team bed inpatient, and we were functional for a little over a year. And then unfortunately, we had to close it down for just for financial reasons, September of 2019.
see. Yeah, no, that's amazing. As you said, kind of those three kind of areas that you have such a great background in. And now with some of these treatment resistant modalities that you're offering, I mean, do you have some firsthand stories kind of for us, or anything that you've kind of seen between the TMS side and the Spravato, whether it be IV or nasal spray, kind of how you've seen that help people that maybe are looking at that as an alternative to trying another antidepressant or working in conjunction with other medications?
Definitely. The main thing is patients need to know a couple of facts. Okay, number one, mental illness is extremely treatable. Most of it. I mean, we're not talking about advances disorganized schizophrenia. This is not a very common condition to be seen in outpatient. So depression and anxiety, bipolar, ADD, insomnia, these conditions are treatable. Now, people who have depressions, big percentage of them, they do have also fibromyalgia, different kind of pain. Chronic pain is depressant in itself. There is a huge coordination between chronic pain and anxiety and depression. As there is a huge coordination between cancer and depression. And there is a huge coordination between heart disease, let it be mitral valve prolapse, let it be coronary artery disease, let it be ICD implanted. All of those, they are associated with anxiety. It's a fact. We cannot ignore it. We just have to face it. But anxiety is treatable. Depression is treatable, very treatable. The problem is people, number one, they don't know that they do have mental health issues. Number two, they, because they don't know they do have a problem, so they don't go seek treatment. And if something you don't treat it, it doesn't go away, just gets worse. And so the mental illness, I tell the patients, like cancer or like infection, it has to be eradicated. You cannot treat it halfway. And I keep telling the patient same thing all the time. I tell them, you lose hope when I lose hope. When I tell you I don't have anything else to offer you, then go ahead and lose hope. And I have not said that. I graduated my medical school in 1995, and I have not said that until today to anybody. So there is hope always. The thing is, we have to be aggressive. Now, because of the setup we have here, I do have an anesthesiologist that's a pain specialist. He does monitor my ketamine infusions. So I do have two standout stories. So when I started doing the ketamine, I found somebody late 50s in his life, came with his mom. And he said, I had over 15 back surgeries, fusion removal, and all that, devices in, devices out. And the only thing worked for me is 2 ketamine infusions back to back. And this will last me 1.5 years to 2 years. And he was up to 500 milligrams of morphine per day, plus the others. Now he's not taking no medicine. Period. Nothing. Okay. So of course he was on the table the second day. he got his ketamine infusion, scheduled the second treatment because he said he needs 2. I mean, you know that they've been doing that for 10 years. And the only reason he came here, nothing unique about myself except the location. He said, I need to drive down 70 miles downtown. So I rather to do it here. It's fine. Then he do the first treatment, book the second one. He didn't show up. And this is over 1 year ago. So this tells me that he does not need 2 treatments, just 1 treatment. So 1 infusion that takes 4 hours. Chronic pain guidelines are different than the psychiatric guidelines. For the chronic pain guidelines, it's 4 hours infusion. Psychiatric guidelines is 1 hour infusion. And we have also have some success with intranasal spray. But unfortunately, it is not as intense outcome as it is the IV infusion.
For sure. Sorry to interrupt. Can you tell me why it works? why it works for so long. I mean, you've been in pain management for a long time. What is it about ketamine that has this lasting effect with someone who's had 15 back surgeries and suddenly you haven't seen it in a year? Why do you feel like it has this lasting effect and it's really a breakthrough?
So we know how ketamine works, but we don't know how ketamine controls the pain. Or we don't know, I'm sorry, we know how it works, and it have been used for decades for surgery. I remember actually in my country, we used to give it for kids, and at the time, over there we call it Ketalar, for IV, for like hernia repairs and tonsillectomy and all that. But so we don't know how. We know it is an NMDA receptor antagonist. These are the same subtype of receptor. These are the same receptors that PCP or angel dust works on, but the PCP stimulate those receptors. So how does it work for a long time? Actually, nobody knows the answer to that. But I was actually in Cleveland Clinic, Ohio, when a couple of pain management authorities at that time, they said, well, this medication have not been used for decades now, as generalized as it used to be back in the days before propofol, and used to use as a compounding cream for patients who have like reflex sympathetic dystrophy in their arms and legs, and they said, how about we trying to give infusion of this medication? And they started that. I'm talking like we're talking like about 25 years ago. And they started using it, and people getting outcome and have becoming more and more popular. And patients know about it, and patients, like I said, patients call us just for that. I have someone else who have cluster headaches, a vet. He was in his 30s. When the headache hits, nothing treats it, nothing. You have to stay like in a dark room, literally like crying, biting the ground for days until the episode goes away by itself, and he doesn't know what's going to hit him. And then he said when he calls his infusion clinic, they give him like an appointment like in a month because they don't have an opening. So they end up after this that we have to. I told them, no, you can call me, and we're gonna be on a table within a couple of days. If you because we have to set up dates for those. Like now we do them Tuesday and Thursday. We used to do them Monday and Fridays. Now, so if he calls me, like for example, Monday, Tuesday is on the table. Even if we don't have openings, we will make an opening for him. Wow. So the availability is, patient care comes number one. Even though we're busy with psychiatric practice, very busy interventional pain practice. Like last year, I was doing close to 80 procedures a week between implant and injections and nerve ablations, and still we have walk-ins. If someone calls saying I'm in crisis, can I tell them, we're not going to do nothing for you. When someone calls me at night saying I'm in crisis, I say tomorrow morning I want to see you. What time should I call? No, don't call, make an appointment, just come in. So we have open door policy. Well, I've been like that. I've been in Texas here close to 10 years. In November 4, I'll be in practice in Texas for 10 years.
That's amazing. And yeah, we definitely applaud you for that emphasis on patient care and that open door policy. I think it's so important that people know that there's someone in the community that can help at all times. Obviously, it's been a very tough year, for mental health with everything that that this pandemic has brought on. So can you tell us a little bit of what you're seeing and maybe some advice that you've been giving out really pertaining to what's come up from dealing with this global pandemic?
Yes, there are a lot of articles out there to show how the mental illness has exploded out of proportion because of the COVID-19. So I'm not an infectious disease doctor. I cannot give an advice on that.
Sure.
Maybe my information on this one would be like a layman person in that field, but especially it's a lethal disease. what I wanted to say is the numbers of people that are positive, these are the people that are tested positive. And the number of people that die, these are the people that died from COVID-19 and maybe also some other correlated disease. Mm-hmm. So always when you look at the numbers, don't compare the positive to the death. Okay, because we need to know how many positive people, so how many people had the virus and never been tested.
Sure.
My assessment, and again, that's like a layman person in this one, that's an opinion, not medical opinion, that's a personal opinion. The number of people that are positive and never been tested, probably multiply the number we have as positive by 20 at least. Mm. Yeah. So now you know. So now you know how lethal the condition is. It is lethal. Nobody can say anything about that.
Sure.
But how lethal it is, we need to know that.
Right.
Just think about it this way.
Yeah, I think the public perception, there's a lot of fear and a lot of anxiety surrounded by that. Yes. So I imagine, you've had an influx of patients with trying to deal with this and essentially what are you saying to kind of keep them in check and to focus on what it takes to keep a healthy mental mindset at this time?
Yes. So you see me now, I have a mask because I'm by myself in a surgical center, mm-hmm. 7,000 square foot surgery center. Mm-hmm. So I have no patients coming here today when I don't have any cases today here. So that's why. But sure. I mean, I cannot tell people, acquire caution, you put on the mask and cleanse your hand. And well, this is common sense. So you hear that everywhere you go. The thing is like the astonishing thing, and the thing that's like basically like break my heart is the surge of mental illness numbers is unbelievable. You're talking. I read an article like 10 times increase. That's 1,000%. So patients come. I mean, a lot of patients. I was just speaking to someone that when I was in the OR earlier today, I was doing some injections, and I was talking to my staff. I had one patient who was asleep, so this was between me and my staff, and I was telling them, people come to me saying like they have no prior history of mental illness, nothing. And they end up now having this depression, and severe anxiety, and then anxiety is driving depression, and then depression is driving suicide. So end up now there's a surge of suicide cases in the Montgomery County. We have now 35% increase of suicide. Like my staff here, they know of 2 people that one staff knows of 2 people in the community here that had completed suicide. Accomplished their mission. It's extremely sad, and that's why I said I have an open door policy. If someone does not feel good, you want to walk into the clinic, you're not going to be turned away. And my staff is saying, "Hey, doctor, I have a patient at the time. It was this also another story. He was psychotic, young guy, and his mom didn't know what to do. So she came in, she walked into the clinic. She said, how am I going to bring him here?" I said, well, so she told me, I collected data from her, and then I told her that's what he has. Most probably, like 95%. That's what he has. Then the good thing is he's going to respond wonderful to treatment, but I just have to, basically get a hold of him. So this, so I said, okay, he trusts his wife, bring him, they have a little baby. So I said, bring him and his wife and his child. And he did. So, but unfortunately, the only time he would come in was after hours. so the staff said, "You remember the patient that came here, the lady that came yesterday?" I said, "Yeah." They said, "Okay, she came in today, but you have like a whole bunch of people with her. She have her husband, her son, her daughter-in-law, and their grandchild." I said, "Okay, let's bring them." She said, "But we're about to close." I said, "Okay, you guys all leave. Just leave one staff with me to check them out, and then that's it. And we'll get them out from the back door, and I stay with the guy, and and start the treatment. If I say no, I'm not going to see him from this time to this time." He said, "Okay, I'm working." He's going to say, "I'm working. I'm not going to see him." And they ended up there one person that we could have helped, that he didn't get no help. So on the other hand, also I do have a family, and we cannot like work like after midnight, 7 days a week. But yes, I'm an answering service. I'm on call 24/7. Yeah, that's on the phone. But I do have a family too. So in a case like this, I call my family. I say, guys, I'm gonna be a little late today because I had this. Like I said, this is another story. Now for the TMS, I do have a story that I wanted to share with you guys. I have a 23 years old female adopted from Russia, and awesome parents, awesome little girl. 23 is like, she's, I call younger, okay? So, because I'm almost 50. She's tried everything, and she started coming to our clinic through the pain management, and we took care of her in the pain management, even though her conditions is a genetic chronic condition that is, unfortunately, there is no treatment for it as we speak now. The only thing is that we're trying to chase the pain. So you have pain in this area, we might do this kind of intervention. You have pain, and that's the only thing we can do. So, but of course, the abuse she went through from her biological mom, going on from Russia to here, have imprinted significant scars in her soul. And she tried all kind of treatments, residential treatment, inpatient, outpatient, partial program, all kind of medication we know of. She tried everything. And then she came to me and she said, I want you to take care of me. Now, ketamine was bad for her, so we couldn't do that. She already tried it outside. So they said, that's the one thing I don't want to, it didn't work for me, I don't want it. Okay. And of course, if something doesn't work for the patient, there is no reason to repeat. So we ended up now having a really tough case. We didn't know what to do. So I said, okay, I want to try the TMS. So what did that? So I educated the family on it. We had her approved. I want to also mention that it's still difficult to get approval through insurances. We need the insurance companies to work with us on this, just because it's a life-changing procedure, and get the patient off the medications, possibly. So really, okay, if any of the insurance companies are listening now, I just beg you to ease off on the patients. Okay. So started treatment, and the only guidelines we followed in the treatment was the mapping. That's it. Everything else was and the timing. So the time on the device was like 19 and a half minutes, or 19 minutes and 20 seconds per session. So we kept those. This is because the machine by itself, but the strength of the stimulation past the motor threshold was her own strength. So nothing when the guidelines will fit into this one. And today she's hurting. She would not go to even close to the desired stimulation, and the day she's not hurting much, and she's in a better mood in general. Then she would be like allowing me to go a little higher. I had set up her treatment every day except only 2 times. I would set it up and let one of the staff observe her, and her mom was with her all the time. And it's amazing that this lady, she got excellent response. And for me, it was like, it was like something different. That you can help. We help people for that's what we do. I mean, you help people every day, but to have someone that had failed treatment for all her life, basically, and you get positive response from something, then you would know that this is an effective treatment. And that's why I'm being pleading to the insurance companies, just want them just to help us out a little bit, to be able to help patients. That's all. I'm sorry.
So amazing. No, not. I mean, we can tell that you're moved by it, and I'm moved by that for sure. To see that firsthand is so amazing. I mean, you mentioned the word earlier, eradication, right? You don't just want to treat mental illness. You want to eradicate it. We use the word, right, remission, right? You said that this young woman had scars on her soul. That's how you described her, and where she started and where she is now based on this treatment is light years away. And I think that is so amazing that you can offer, that you're a beacon of hope really to your community and the families there. And, even at your own sacrifice to your own family, I think what you're doing is absolutely amazing. And we're so honored to have you on today and to get to hear some stories for sure. I know we got to go, we're low on time, but I wanted to give you the opportunity again. Thank you for everything, but just the opportunity to leave us with any last thoughts that you have.
Okay, so the last thought, I'm repeating myself again, guys. Mental illness is treatable and can be eradicated, and we should go after it. We should treat it fully. Everybody is entitled to be happy. Everybody's entitled for their anxiety to be controlled. Everybody's entitled for their bipolar to be in a good check. Mental illness, the treatment of mental illness is not brain-altering medications. The medication effect does not last your lifetime. And after, I tell my patients, once we come into a stability of your condition, anywhere from 6 months to 2 years in the stable stage, we should get you off the psychiatric medications. Okay, so nothing, please. The treatment is not lifetime. The treatment is to the stability and keep you stable, and then taper you off the medication to move on with your life. So remember that. So the thing about the mental illness is a treatable condition, and it is only time limited. Okay, and then the only thing is you just have to treat it aggressively, and you need to do your part to call professionals to get that.
Absolutely. Well, I think that's amazing, and we really appreciate all the modalities that you guys are offering and how you're helping so many people out in the community out there in the Woodlands area in Conroe. And we wish you the best of luck. Keep up the good work. I know you got a lot of work to do, out there, and we're going to get through this year and be resilient for sure. But mental health issues will continue to be ongoing, and that's what you're there for. So we really appreciate your time today. Thank you so much, Doctor.
Thank you. Thank you.